Hi everyone, so today I would like to present a topic entitled Seizure Disorder and Epilepsy. What is seizure? Seizure can be defined as temporary, involuntary change of consciousness, behavior, motor activity, sensation, or automatic functioning. So there are 5 types under the category of generalized seizures. The first one is tonic-clonic, the second one is absence, the third one is atypical absence, the third one is myoclonic, and the fifth one is atonic forms. For the partial seizures, there are only 2 types, which are simple and complex partial seizures. For tonic-clonic seizures, it usually involves neuronal firing from both hemispheres in the symmetrical pattern and followed by loss of consciousness, and the body will become rigid. Meanwhile, for the absence seizures, it usually involves momentary loss of consciousness and the absence of motor activity except for eye blinking or rolling. Next is atypical absence. It is characterized by slow spikes of activity between seizures with wave activity that is asymmetrical, low amplitude, or irregular. Next is myoclonic. Myoclonic involves contraction by single or small group of muscles. Last but not least is atonic forms. This type involves sudden loss of muscle strength. Moving on to partial seizures. Simple partial seizures is an unusual electrical activity that affects small area of the brain but does not affect consciousness. Next is complex partial seizure. It is a focal seizure that starts with one hemisphere of the brain and associates with impairment in consciousness. Next is epilepsy. Epilepsy is a chronic neurological condition of recurrent seizures that occur with or without the presence of other brain abnormalities. Moving on to the treatment of seizures. The first one is anticonvulsive medication. Anticonvulsive medication it helps to increase the intensity required to trigger the seizure or eliminate the recruitment of surrounding cells. For the anti-epileptic medication, it helps to reduce the number, severity, or the duration of seizures. Next is anti-epileptic therapy. This includes ketogenic diet. Ketogenic diet can be done by carefully monitor the intake of sugars, carbohydrates, and fats. Last but not least is surgical intervention. This can only be used when the adequate control of seizures cannot be achieved by medication. Last but not least is the emergency treatment of seizure. The first one is to remain calm. The second one is to time the seizure episode. The third one is to protect the child. And the fourth one is to check the child's breathing. If it's not present, then we have to do the mouth-to-mouth resuscitation. The fifth one is to check around the child's mouth area if there are anything suspicious that indicate poisoning. The sixth one is to remain with the child. The last one is to seek help if the child is not breathing.